Hello everybody, my name is Nicholas Christensen, and today I'll be presenting my Nursing 210 evidence-based project, an unfolding case study. Alrighty, so topic and overview. So my concept is perfusion, more specifically heart failure, and my culture is urban poor and public housing and assistance, and my age group is teenager. So concept description. So perfusion is defined as the mechanism that facilitates the flow of blood through the circulatory system to tissues and organs. So perfusion is a vital component of life, as the heart pumps blood to deliver nutrients to cells, support bodily function, and support brain function. And heart failure. So heart failure is the heart and its muscles are unable to pump enough blood to meet the body's oxygen needs. So both systolic and diastolic heart failure affect the left ventricle. In systolic heart failure, the heart muscle is weak and the ventricle can't contract normally. With diastolic heart failure, the heart muscle is stiff and the ventricle can't relax normally. So now that we got that out of the way, we can meet our patient, Ryan Hernandez. Alrighty, introduction. So Ryan Hernandez is a 15-year-old boy admitted to the hospital with shortness of breath, fatigue, a rapid heart rate, jugular vein distension, and edema of the lower extremities. Ryan was brought to the hospital by his mother after complaining of difficulty breathing while lying down. Ryan lives in Harlem, New York, in a public housing provided by the U.S. Department of Housing and Urban Development, or HUD, with his mother, Andrea Hernandez, a single mother who works 2 jobs to pay for Ryan to attend school. Ryan has a past medical history of tetralogy of Fallot and type 1 diabetes mellitus, and a family history of diabetes, as both Ryan's mother and father were diagnosed with type 1 diabetes. Ryan's father passed away 4 years ago from a myocardial infarction due to a history of coronary artery disease. Ryan currently works at a local fast food restaurant on the weekends to help save up money so that he can buy new clothes and shoes so he's able to fit in with others at school. So what is most concerning about Ryan? Currently, the most concerning thing about Ryan are his symptoms, as shortness of breath, fatigue, a rapid heart rate, JVD, and edema of the lower extremities all point to potential heart failure. Alrighty, so a review of systems. So Ryan's vitals are currently a blood pressure of 95/58, a pulse of 102, a respiratory rate of 20, a temperature of 98.8, and a pulse oximetry of 92% currently on room air. Ryan is alert and oriented, but is currently complaining of shortness of breath. His skin is warm and dry, with 2+ pitting edema of the lower extremities. Upon auscultation of the lungs, there are bilateral crackles in the lower lobes of the lungs. Auscultation of the heart reveals normal heart sounds, no murmurs or extra sounds with S1 and S2 present. Inspection of the abdomen revealed normal active bowel sounds and no tenderness or masses. Ryan's current blood glucose is 126, with a body mass index of 21.8. Alrighty, so what are the risk factors for heart failure? So after hearing Ryan's introduction and review of systems, we can point out multiple risk factors, including tetralogy of Fallot, which is a congenital heart defect that occurs when 4 specific heart problems develop together, those being ventricular septal defects, which is a hole in the wall between the heart's 2 lower chambers, overriding aorta, which is the aortic valve is enlarged and receives blood from both ventricles instead of just the left ventricle, pulmonary stenosis, which the pulmonary valve and main pulmonary artery narrow, which blocks blood flow from the right ventricle to the pulmonary artery, and finally right ventricular hypertrophy, where the muscle walls of the right ventricle thicken due to high blood pressure. We also have type 1 diabetes, which is high blood sugar. High blood sugar can damage blood vessels and nerves in the heart. Family history of coronary artery disease also contributes to a risk factor for heart failure. Environment. So New York air pollution. Air pollution can make blood vessels narrower and harder, which can make it harder for blood to flow and increase the risk for blood clots. And then finally, stress. So Ryan's life is very stressful right now, having to manage school, low-income living, and working, while also working to support his mom and have friends and a social life. It can all be very stressful and add to additional stress, which may be a risk factor for heart failure. Alrighty, so what else should we know about Ryan? So current medications, more information about his diet, social history, physical activity, stress management strategies. Why are these things important to know? So it's important to have a thorough health history so we can begin to develop a care plan and organize interventions based on Ryan's wants and needs as well as current implemented interventions. Alrighty, so current medications. So I'd like to know what kind of medications is he taking for his TOF currently? More information about his diet. We already know he works in fast food, so is he eating a lot of salty foods? Social history. What's his friend groups like? What kind of groups is he hanging around? People who smoke, people who drink? Physical activity. How much physical activity does he get per day? Does he live a more sedentary lifestyle, or does he walk around a lot? And stress management strategies. So what does he currently do to manage stress, if he has any? Alrighty, so interrelated concepts related to heart failure and perfusion. So metabolism, more specifically diabetes. Ryan has type 1 diabetes and is unable to afford regular insulin, although he is able to monitor it regularly. So Ryan and his mother are unable to afford regular insulin to treat Ryan's blood sugar, which could be potentially dangerous down the line if his blood sugar becomes hypo or hyperglycemic, meaning too low or too high. So nutrition, access to food. Ryan's mother is unable to afford fresh, unprocessed foods and often has Ryan purchase food from his job and bring it home. So because Ryan works in fast food and Ryan's mother struggles to afford fresh, unprocessed food, Ryan often brings home food from his job, which his company allows him to do. However, this food is high in cholesterol and fat and may lead to issues down the line, such as hyperlipidemia, which may lead to atherosclerosis and even occlusions later down the line. So mobility, transportation. Ryan can't afford public transportation and so walks to school and work. So Ryan walking everywhere and not having access to public transportation or vehicles of his own may affect his access to healthcare if a hospital is not in walking distance. So perfusion, tetralogy of Fallot. So structural abnormalities cause the heart to become weaker. We talked about this earlier. Gas exchange, smoking. Ryan's mother smokes a pack of cigarettes per day in the house. So cigarettes lead to vasoconstriction, which may lead to hypertension, which will also end in heart failure. So if Ryan is breathing in a lot of this secondhand smoke, this could contribute to his risk factor for heart failure. And then finally, family history. CAD. Ryan's father having CAD puts Ryan at a greater risk for developing it down the line. Alrighty, so nursing interventions. So first, heart failure. So we're going to want to monitor Ryan's vital signs, intake and output, and also his symptoms. So fluid in the lungs, SOB, fatigue, JVD, and we also want to monitor his weight daily. This is all to monitor the extent of his heart failure. And then finally, we might want to consider giving him some medications such as diuretics, beta blockers, or digoxin to help treat his heart failure. So what are the indications? So we're monitoring vital signs for improvement of blood pressure and oxygen saturation. Intake and output monitoring to ensure that circulating fluid volume decreases and that furosemide is working effectively. And then we also want to make sure that the medications such as beta blockers or digoxin are helping to slow the heart rate down and help it pump more frequently. And then finally, we're going to monitor daily weight to monitor his edema and fluid retention. Our next intervention is diabetes. So we're going to want to discuss with Ryan and his mother about Medicaid, educate Ryan on blood sugar management, foot care, and insulin injections, and encourage a balanced diet and regular checkups with regular physical activity. So indications. So discussing eligibility for Medicaid with Ryan and his mother may be effective in helping with the cost of insulin. Educating Ryan on diabetes management is important, as he stated he does not know much about managing his diabetes. And encouraging a balanced diet is also essential, as fast food does not have the proper nutrients to support a growing teenager and may also work to spike his blood sugar. Alrighty, so nursing interventions continued. So access to healthcare, third intervention. So we're going to want to discuss with Ryan the possibility of acquiring a student Omni card provided by his school, which may allow for free transportation to school. And then we're also going to want to discuss Medicaid as a free transportation service and medical coverage relating to healthcare resources. So indications. So a student Omni card would cover the cost of a bus or metro for current students and is provided by most New York students' schools to provide transportation. This may reduce Ryan's stress and exposure to environmental pollution such as car exhaust, which may exacerbate his heart failure. Providing Ryan with resources via Medicaid to arrange free transportation to the hospital and coverage of insulin will help manage Ryan's diabetes and will allow for continuous follow-up with Ryan and his condition. Alrighty, so our fourth and final intervention is education. So we want to educate on prescribed medications and their side effects, possible dietary changes, the dangers of secondhand smoke inhalation, and managing stress relating to work and attending school. So, indications. So verbal understanding of education relating to medications is essential, as Ryan and his mother do not have easy access to resources relating to medication information due to location of living and lack of cell phones. Ryan's diet consists of processed foods, which again may lead to coronary artery disease, so we want to make sure that we educate him on a better diet. And then finally, we want to educate him on the danger of secondhand smoke inhalation from his mother, whether that be stepping out of the room while she's smoking or encouraging her to stop smoking in general. All right, so expected outcomes for Ryan. So the first outcome is Ryan's symptoms of heart failure will be controlled by the end of the shift. So decreased respiratory rate, 16 or below, increased blood pressure above 110/70, decreased pulse below 100 beats per minute, and absence of crackles in the lower lobes of the lungs, as well as reduction of edema. These would be ideal by the end of shift, these vital signs. Our second goal would be Ryan will verbalize understanding of medication regimen and what each medication is prescribed for, as well as the side effects to watch out for with each medication. So his digoxin, his beta blockers, furosemide, we want to educate him on how to take them, when to take them, and also the side effects to watch out for with these medications. So the third expected outcome, Ryan will verbalize understanding of diabetes education. So he'll understand the risks of improper diabetes management as well, such as foot care, improper diet, and improper exercise. Our fourth expected outcome is Ryan will verbalize understanding of the importance of proper transportation and will schedule a follow-up appointment with his mother in 3 months' time to monitor heart failure and diabetes management. And finally, 5. Ryan will verbalize understanding of the importance of avoiding secondhand smoke from his mother and will provide the nurse with 3 healthy coping strategies he plans to implement relating to controlling stress that can be used at work, home, or school. So examples of these healthy coping strategies may be exercise, whether that be running, walking, jogging, or weightlifting, deep breathing or meditation, journaling, or developing a hobby such as a musical instrument, art, etc. Alrighty, so now let's take a look at some of the interdisciplinary team members and the possible interventions that they can provide to help Ryan. So first of all, why is the interdisciplinary team important? So it's important for improving patient safety, as interdisciplinary team members can help reduce the risk of adverse drug reactions, medication errors, and preventable complications, reducing costs, expediting patient information, and faster treatment. So now let's take a look at some of the team members. Registered nurses. So registered nurses can help for monitoring pain, managing symptoms, providing comfort care, coordinating treatment plans, medication education, and most importantly, advocating for Ryan when needed. So dietitians. So dietitians can help to create a personalized plan to help Ryan promote adequate nutrition and can help work with Ryan to create a meal plan with his likes in mind. And this is really important because it helps with compliance. When you're giving someone a whole new meal plan, it's important to include some of their foods so they're more inclined to follow the diet. So respiratory therapists. So respiratory therapists can help to manage Ryan's shortness of breath, provide updates on Ryan's respiratory status, educate relating to lung disease or breathing issues, and diagnose any other respiratory issues. So physical and occupational therapists. So physical and occupational therapists can help to slowly improve physical strength and achieve exercise goals as relating to heart failure, while also writing goals for exercise for Ryan to improve his current heart failure, and developing goals for patient outcomes based on Ryan's preferences. Again, we want to have Ryan's preferences in mind, so if he has any activity or exercise that he prefers, we're going to want to write that into the goal, as this will help with compliance. So healthcare providers. So sharing knowledge and skills to create a healthcare plan for Ryan. Communicate openly with other nurses, healthcare providers, and the family about changes in status and recommendations, while also upholding ethical values and patient-physician confidentiality. And then finally, they can prescribe medications for Ryan to help his condition improve. So close family members. Close family members are a part of the interdisciplinary team, as they can provide valuable information to the healthcare team about Ryan's medical history, participate in decision-making relating to Ryan's care, and provide feedback relating to patient outcomes, and most importantly, act as an emotional support for Ryan. This may be a really tough time for him, so it's important to have close family members in the room to help with decision-making and coping. And then finally, the pharmacist/pharmacy. So they can initiate or modify drug therapy, educate on importance of medication regimen, monitor drug therapy and prescribe medications, and identify drug-related problems such as allergies or adverse and side effects of drugs. So a lot of these team members have overlapping goals, and this is important because this prevents any mistakes as they all check each other. Alrighty, so cultural considerations for Ryan. So let's start by defining cultural consideration. It's defined as providing client-centered care with respect to cultural differences and preferences such as patient beliefs, values, and practices. Nurses should recognize cultural backgrounds to help avoid misunderstandings and ensure that patient treatment goes along with patient beliefs and preferences. It's one of the most important aspects of nursing that is often undervalued. So now that we have that defined, let's look at some cultural considerations for Ryan. So language. Although Ryan's first language is English, Ryan's mom, Andrea's first language is Spanish. It may be important to have an interpreter on standby to avoid misunderstandings and may put the family at ease. Family. Speaking of which, Ryan is not an adult and so cannot make decisions on his own. However, family is often central to Hispanic cultures, and so ensuring Andrea, his mother, is a part of discussions is important not only for decision making on behalf of Ryan, but also for cultural respect. So this ties into the language. If we're having Andrea in on conversation and discussions, we're going to want to make sure we also have an interpreter on standby so that communication is communicated clearly. Traditional beliefs. So many cultures have different preferences relating to aspects of healthcare and may not believe in traditional medicine or modern healthcare. This may be an important factor when prescribing medications or developing teaching plans for Ryan. So this is an important conversation to have with Ryan and his mother, because if they don't believe in traditional medicines, we may have to look at some non-pharmacological ways of treating this heart failure, because we can't send them out of here without treating them. So, finally, diet. Although Ryan's diet needs improvement, it's important to incorporate traditional Hispanic foods into the meal plan as well, to show appreciation for his culture and also help to promote compliance with his new diet changes. Another factor to consider when planning his diet may be the price of food. So it's important to choose low-cost ingredients and then possibly talk to Ryan and his mother about food stamps to help with the cost of food. So traditional Hispanic foods that you may want to include in the diet may include tacos, menudo, burritos, tamales, quesadillas, or enchiladas. Alrighty, so Ryan's outcome. So Ryan has been discharged from the hospital on his medication regimen and has agreed to all discussed interventions. He plans on following up to the hospital in 3 months for a health checkup. So we hope to see a follow-up with Ryan in 3 months and notice an improvement in diabetic care, diet, exercise, and heart failure management. Although his living and financial situation is unlikely to change, we hope to see an increased access to transportation and access to healthier food choices, as well as a decrease in Ryan's stress relating to the improvement of other interventions. Alrighty, so that's about the end of our story with Ryan. So these are my citations. If you guys have any questions, please let me know. Thank you for listening and have a great day.